There we go. Alrighty. Hello. Good morning, everybody. It's still morning, right? Yep, it's still morning. Hi there. My name is Jackie Moore. I'm a clinical social worker and one of the therapists here at Canopy EAP, as well as one of our senior trainers. And thank you all so much for being here today. We are going to be talking about holistic approaches to anxiety treatment. So this is a CE. And I do have a couple of quick sort of housekeeping things to go through first before we dive in. So I am going to kind of just start off there. First and foremost, I'll pull this up on the slide. So hopefully folks are seeing something like this on their screens. Unfortunately, with the platform that we're using with the GoToWebinar, I'm not going to be able to see or hear you directly. Now, that being said, though, I absolutely do want to hear any questions, comments, thoughts that might come up throughout the course of the training. So if you go ahead and look on your screen there, you should have some kind of sidebar, side panel, something like that. There are a couple of different drop downs in there I wanted to point out really quickly. So the first one is going to be, there is a drop down that's labeled questions. If you click on that drop down, you can feel free to put any kind of questions, comments, thoughts, feedback directly in that box. I do have direct access to it, so I can definitely speak to anything that comes up pretty immediately. I will say, because this did happen to me once before, so I try to avoid it going forward. You might notice there is another drop down that says chat. Please don't use the chat box for any questions or comments. That chat box is actually meant for the participants, so I can't see it. So if you send something in there, I'm not going to be able to see it. So I don't want you to think I'm ignoring you. I can't see the things in the chat box. Those are meant for participants. So if you wanted to have if you had a question or a comment, please feel free to use the questions box. I can see that one. Now, additionally, there is another drop down on that side panel there that's labeled handouts. If you click on that drop down, there should be two things in there. So the first is actually going to be a copy of the slides that I'm using today. If you are wanting to grab a copy of those slides for later or take them and look more in depth later, please feel free to do so. Those slides are available for you to take. Additionally, there is a sort of GoToWebinar tech help. I do appreciate that, especially over the last few years, we've very much been at the mercy of our technology. So if you are having any tech issues, unfortunately, I can't do a lot on my end to sort of help fix that. I will say that if you are having issues, always good to just try starting it and restarting it, turning it on, turning it off. And then if you are having further issues in that drop-down section of the handouts, there is a copy of a GoToWebinar tech help, and that has some sort of quick fixes, common issues with the GoToWebinar. So you can definitely take a look at that too to see if there's anything there that might help and address any of the issues that are coming up. Okay, I see a question. I do not see the handout section. Are folks not seeing the handout section? It should be right there on that side panel. For me, it's I think it's going to be under kind of like audio or the visual, but it should be just right in that side section there. This is also being recorded as well, so I do want to let folks know that this is being recorded. So if you wanted to watch later, or if you have to leave early or anything like that, there is going to be a recording. So there. Download the handouts, but it appears blank. Interesting. Okay, that's straight. So it is showing up in the handouts. If we're having that issue, we'll be sure to get them sent out directly to you all via email. So if you're not able to access them right now in the handout section, totally fair. I will make sure that they get sent out via email as well. But that's strange because I swear they're there. I put them in there about 5 minutes ago. So they should be in that handout section, but who knows with this technology. So we're all guessing here. Okay, it looks like some folks were able to get them. Who knows, right, with this tech. So I'll make sure that I do get them sent out either way so that folks have a copy of it. Now, folks are already doing what I was going to ask, which was I was going to ask if people did not mind going into the questions box really quick and just letting me know if everybody is able to see and hear me okay, because of course I don't want to talk at myself for the next hour. So, but it looks like everybody is able to see and hear me okay. Yep, we're okay. Beautiful. Looks like we're good. Okay, and thank you all so much for bearing with me on the handouts, but I will definitely make sure that if it's not there, we'll get those sent out via email afterwards. Now, before I dive in, I do want to just kind of let folks know sort of the framework we're coming at here. So everybody on this call, currently everybody in the GoToWebinar at this moment is a clinician of some kind. So everybody on this call is some type of mental health provider, some type of mental health clinician. Consequently, we will be talking today very much from a clinical lens. I know all of us are probably fairly well versed in anxiety treatment and are probably dealing with that on a very, very daily, regular basis, and have probably your own specific skills and interventions or your own sort of preference in terms of how you address anxiety. So of course, keeping all of those components in mind, what I did want to talk a little bit about today is sort of things that step a little bit outside of the clinical realm in the sense of a more holistic approach. So we are going to talk what is holistic health, what are sort of the main pillars of that, and then what are some more recent ideas, suggestions, options that exist for holistic treatment of anxiety. So I will go in depth on a few things in particular, just because I do think that they probably would be good to chat about a little bit more in depth. But we are going to be talking about some holistic options for anxiety treatment, and then I will go, like I said, a little bit more in depth on certain options, just because I think that they're good to touch on, and there's definitely some stuff that is newer that maybe we wouldn't be necessarily as familiar with. That being said, of course, I do very much acknowledge that everybody on this call is very much an expert on anxiety and is certainly an expert on treatment. And so to start off with, I did kind of want to ask folks if you wouldn't mind sharing in that questions box, do we get a certificate at the end of the training? You will receive credit for the CEs. So you should be receiving an email for that. I don't know if there's like a specific certificate, to be honest. I don't want to mislead you. There might be a very specific certificate, but either way, you do get the CE credit for sure. So that being said, as we kind of get started here, the question I kind of wanted to pose to all of you is right now, what is sort of your go-to methods for anxiety intervention? And I'm thinking pretty broadly here. I don't necessarily mean like very specific interventions, but treatment modalities or things like that. What are folks using? What are we using for anxiety treatment? If you didn't mind sharing. So I'm seeing Coping Cat Workbook for Kids, CBT, CBT, EMDR, mindfulness, ACT, polyvagal, neurofeedback, CBT, 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 ACT, mindfulness, DBT, CBT, EMDR, breath control, polyvagal. Okay, yeah. All right. Absolutely. EMDR, self-talk, CBT, mindfulness, CBT. Are we using CBT? No, I'm just kidding. Yeah, absolutely. These were kind of the ones that I was thinking folks were gonna share. And that's kind of how I started off with, which is right now when we think about anxiety treatment, I think a lot of us probably have some things that we are going to default to, that we know work, right? We know how to operate in those, and we know their effectiveness for our clients. So as a lot of folks mentioned, CBT is probably going to be the #1 form of treatment that is used for anxiety currently, and for good reason, of course. I'm sure most of us are pretty familiar with CBT, right? There is a lot of evidence-based research behind CBT and certainly has been shown to be effective in the treatment of anxiety. So that is absolutely going to be one of the most common options. Of course, we also do see medication as a common intervention. I know most of us are not necessarily doing that medication management, but certainly something that we might recommend. And to kind of highlight this, I actually like to share that over the pandemic, we saw a pretty substantial increase in prescription medications for anti-anxiety and antidepressants. From March of 2020 to June of 2020 alone, there was around a 35% increase in prescription medications for anti-anxiety and antidepressants. So medication is certainly going to be a common one. Obviously, cognitive therapy, which ties in a lot with CBT, is very common. Some folks mentioned sort of coping skills, to talk about psychoed, what is anxiety, maybe folks who work with kids a lot as well are maybe kind of going into that realm of psychoed a bit more. And certainly I just put in that very broad, very general talk therapy, which I'm going to guess almost everyone on this call is utilizing probably on a daily basis. Now I throw these up here because these are certainly a default for us when we think about anxiety treatment. We do know that these things provide help and support and relief, and that certainly can be very effective for a lot of clients. And for that reason, we use them, of course. Now, as I'm sure a lot of folks are aware of and know, in the last 20 years or so in particular, we have really seen a movement of sort of no longer keeping mental health siloed away from other areas of well-being, right? And that we recognize that mental health has a very direct impact on all these other areas of our life, and vice versa, right? All these other areas of our life are going to directly impact our mental health as well. It is in this kind of shift in mentality, I think it's a very big shift in perspective, that we've really started to see an increase in folks sort of addressing holistic healthcare. Right? We've even seen, agencies pop up that really identify themselves as holistic providers. And again, just overall recognizing the influence of all these different areas of our life on mental health and how we might begin to address these. So I want to talk a little bit now about holistic health. So when we say holistic health, I'm guessing that most folks probably have an idea of what that means. This is an approach to wellness that simultaneously addresses the physical, mental, emotional, social, and spiritual components of health. Basically, it is an all-encompassing form of treatment, right? We are addressing all areas of someone's experience. We are noticing and addressing all parts of that person's day-to-day life, which of course includes our mental health, but it is not just our mental health. Now, if you kind of look into this a little more in depth, you'll find that generally there's considered to be about 8 core pillars of holistic health. And I do have them all listed up here. I'm sure a lot of them wouldn't surprise folks. I think we could probably guess a lot of these just based off what we know on holistic health. But this is going to include obviously our physical health. This is the one I would say is most integrated at this point with mental health. We have done a decent, there's been movement, right? There's been movement in terms of integrating physical health with mental health. Nutritional, right? Of course, I think that ties in a fair amount with physical as well, but obviously what we consume, how that has an impact on, ranging from our neurotransmitters and our gut health and all of that, all the way up to just, how it impacts our mental health through the substance itself. Emotional health, certainly an area we are all familiar with, probably the area where we sit in the most. I'd probably argue that's the space that we're probably most familiar with and feel most like an expert in that space. So the social piece, which I think also really ties in emotionally as well. I'm sure that's something a lot of folks are addressing in their work. And then spiritual, which is that sort of higher power concept. I really like to emphasize here that when we see the word spiritual, there is sort of this immediate assumption or connotation that spirituality refers to a religion of some kind. And don't get me wrong, it certainly can, right? Spirituality absolutely can refer to your religious beliefs. But there are many folks who do not necessarily identify with a particular religious affiliation, and spirituality is still something folks access, even if we don't have a very specific religious group we're a part of. So exploring that piece as well. And intellectual, how we continue to learn, be constant learners, be curious, grow, continue to expand, evolve, adapt. And that can be professionally, but it can also be personally too. Financial, I think this one is not talked about enough, and we don't recognize maybe just how powerful this one can play a role. Especially, I know all of you for the most part are going to be EAP providers in some capacity, but of course many folks at this point are moving away from insurance, right? And we're moving into this space of more private pay and then talking about access to services, right? And that financial piece is going to be very important for a lot of folks. And then lastly, environmental. I think, again, this one probably doesn't surprise folks, but the environment we are in, both in the literal sense of, the room I'm currently sitting in, but environmental also meaning, the country that I live in, the state that I live in, the city that I live in, the people I am surrounded by. Right? Now, all of these different pillars play a very fundamental role in our well-being. I'm sure we all are aware of this, right? But when it comes to the treatment aspect, I think there can be still some room there in terms of accessing more supports to address all of these different pillars. So, of course, keeping in mind the things that we are more likely to default to, as a lot of folks listed, we do have some other things to be taking into consideration. Now, before I move on to the next slide, because the next slide I have up is going to be basically a pretty large list of some holistic treatment options, I do want to ask folks first, Are you currently using any holistic treatment options, or are you making any recommendations to clients that you feel address some of these areas, some of these pillars? I'd be very curious to hear if folks are already feeling like there's some things I'm using or some things I'm recommending. Do folks have any thoughts, anything that you feel like you're using that might fall under that holistic umbrella? It's of course very broad, right? So like I said, definitely not something that maybe you have to do in the office, but maybe even you're just recommending. So definitely encouraging fitness and exercise is part of that, social and friends, and spirituality. Yeah, I use ear acupuncture, nutrition, and environment with my clients. For clients, I have spiritual background, and I encourage them to maintain a connection to that, certainly, especially if that's like a specialty. Nutrition, I stress the importance of meeting their basic physical needs, exercise, sleep, water, seeing friends. All of those sleep habits. I talk about nutrition, spirituality. Awesome. Wow. Okay. It looks like a lot of folks are really recognizing some of those spaces and really making sure to include those. So exercise, healthy diet, making sure you go to the doctor, exercise, yoga, stretching, their faith, nutrition. Yeah. All right. Absolutely. I really appreciate that. It looks like folks are really, really seeing that there are necessary spaces here, and we're already kind of addressing them. So let's dive into this a little more. Folks, you mentioned a lot of ones that I even have up here. Yeah, already mentioned quite a few that I've got up on this list. Now, the first thing I'll say is that this is a non-exhaustive list. There are more things that could fall under the idea of holistic treatment. What I have up here are considered to be kind of the most popular, the most common, and most easily accessible. And I'll acknowledge that not all of them are easily accessible either, but are most easily accessible. So let's go through these. I am going to go into much more in depth on a couple of these that I really wanted to spend a little bit more time on. But we can also go through these fairly quickly too, and just do a little overview on some of them. So acupuncture was one that somebody already mentioned. So I'm not sure if that's in terms of providing that acupuncture yourself or just making those referrals and recommendations. For folks unfamiliar, acupuncture is really going to refer to sort of using sort of needles that go into very specific locations of the body that are based more on like pressure points and things like that. There's a lot of research to show that the assistance that can be provided there from a mental health lens, as well as a substance use lens. I used to work in a 28-day inpatient facility, and we actually had an acupuncturist on site. It was part of the treatment options. So that is certainly available. Aromatherapy is a broad term, but that's going to be referring to smell, of course. You know, folks who maybe utilize things like essential oils or oh, we have some folks who administer ear acupuncture. Very cool. That's amazing. So absolutely can do both, right? But aromatherapy, of course, is going to be that sense of smell and engaging with that sense of smell. I did not know that. Wow, thank you for that comment. Acupuncture is covered by OHP to treat addiction. Very cool. I did not know it was covered by OHP. That is really great to know. I appreciate that. Thank you very much for sharing that. And I think I'd just like to highlight, I think that really shows its efficacy, right? That we've even got OHP willing to pay for it in terms of substance use treatment. So awesome, right? All right, next kind of art therapy, very broad lens. There are folks, of course, who have that very specific certification. They identify as that a specialty, right? Utilizing art as a form of therapy. Really, this is referring to that creativity piece, right? How we can kind of be creative or get creative. And again, art obviously can look like a lot of different things. It's very broad. And this is something I also like to highlight, can be utilized both in session and outside of session, right? Oh, great question. OHP stands for the Oregon Health Plan. I am currently based in Portland, Oregon. I'm going to guess a lot of providers on the call right now are also based in the Oregon area, but I know not everybody is. So if you're not in Oregon, then you can kind of skip that comment I made. OHP stands for the Oregon Health Plan. So that's an insurance plan for folks in Oregon. So sorry about that. That one is very location specific. So if you're not in Oregon, you can kind of ignore that one. All right, so art therapy, as I say, that is something you can do both in session and outside of session, which can be really great as an option, either in terms of homework or just helping facilitate in session as a skill. Now, biofeedback is, that is going to be kind of a specialty one. That's not necessarily something that is super easily accessible, but it does involve using visual or auditory feedback to sort of teach people to recognize the physical signs and symptoms of stress and anxiety. Now, what are some of those visual or auditory feedbacks? That's usually things like your heart rate, body temperature, muscle tension. So it's actually really learning how to essentially read your body cues in order to sort of have a better understanding of your experience with that anxiety. So it also a lot is used in terms of reestablishing that mind-body connection for folks who are maybe struggling to get in their bodies, especially maybe folks who have a trauma history, things like that. Biofeedback can be very helpful. Now, herbal medicine or breath work, oh, I skipped one. Breath work, I'm going to go in more in depth on, and herbal medicine, I'm also going to go more in depth on. So I'm going to pause on those because we'll get to those in just a little bit. Homeopathy is an alternative medicine based on the theory of treating like with like. So using like with like. So its claims are to stimulate healing responses to disease by administering substances that mimic the symptoms of those diseases in healthy people. Very complicated, to be completely honest. I don't think I fully understand what that means either, but there are, of course, specialty providers who provide this type of service. Very fair if that's not something that you're familiar with or something that you provide. But this, I do believe, comes from a more Eastern medicine sort of perspective. Now, hypnotherapy, there very well might be folks on the call who are hypnotherapists or have that credentialing or have that background. Of course, it's going to be using that hypnosis to sort of address some of those symptoms and underlying issues. That one, I do believe, you do need to have credentialing or some kind of education in to provide that type of therapy specifically. Now, light therapy for the people in the Pacific Northwest or just people who are, up in the more northern parts of the United States are probably fairly familiar with light therapy. It is exactly what it sounds like. It's getting that sunlight, whether that is, the literal sun and getting more access to it, but also, man-made or fabricated options for sunlight. So things like, yes, are you referring to red light, infrared therapy? Yep, stuff like that. I also, even from my research, they even kind of include the idea of, the happy lamps that I'm sure, we're all kind of familiar with that give that light, but even recommendations for things like tanning, where you get more access to this, to that kind of light as well too. So yes, exactly. Red light, infrared therapy, things of that nature. Again, probably something that you maybe would want a specialty in or refer out for that if that's not something you're familiar with, but certainly an option. Absolutely. Massage, I think probably folks refer to that one, maybe are familiar with that one, maybe even recommend that one. And that just is that body connection, right? It's just getting that physical touch, getting the muscles relaxed, right? All that. Mindfulness was brought up repeatedly in the chat box. So mindfulness is definitely something that it sounds like a lot of folks are pretty familiar with and are likely utilizing. For folks who maybe are a little less familiar, mindfulness is really that it's a very, very old concept. It goes back thousands of years, but it's the concept of staying present in the moment without any kind of judgment or shame towards what you are experiencing or feeling, right? So being present and receiving your emotions, your thoughts, your feelings with an air of curiosity, with the air of support and love. And mindfulness is certainly a skill set that really requires some practice, I would argue, but is something we can be doing ongoing. Now, this ties in a lot with meditation. People tend to use mindfulness and meditation somewhat interchangeably. They're not ultimately the same exact thing, but meditation is very frequently used to help folks sort of build the skill sets for mindfulness. Meditation, of course, referring to holding your focus on something very specific. Usually it's the breath. We usually see folks are focusing pretty intently on the breath, but it can be other things. For example, sometimes it's a mantra where we sort of are repeating a mantra, or we'll get to a little later, but using specific sounds, so like gongs, bells, things like that, where you bring your focus back to those as well too. This helps, of course, with staying present, staying engaged with where your body is and where your brain is, but slightly different in the sense of meditation. We're trying to bring our thoughts back to that thing we're focusing on. And in mindfulness, we're not trying to bring our thoughts anywhere in particular. We're just trying to notice them without judgment. Certainly, there's a lot of mindfulness trainings out there. If this is something you are interested in, there's a ton of research in terms of its efficacy and the way that it helps support folks for a wide assortment of mental health issues. It is definitely very commonly used for anxiety and depression in particular, just because it sort of really zeroes in on those symptoms of rumination, but can be used for a wide assortment of mental health issues. Now, nutritional and dietary changes are also something I'll probably talk a little bit more in depth on, but folks were mentioning this one in the chat box as well, in terms of how much, you know, and what we're consuming into our bodies. For example, and I'd be curious if anybody else is asking questions like this, but you know, when I meet with a client for the first time and they've listed that, you know, anxiety is one of their primary issues or symptoms, and they're talking about that experience, they very frequently will ask folks stuff along the lines of how much caffeine they're consuming, right? How much coffee, energy drinks, sugar, stuff like that. Because certainly if someone's coming back at me and saying, well, you know, I had 12 shots of espresso yesterday and 2 monsters, that's going to make me look at the situation maybe slightly different from somebody who's saying, you know, I have 1 cup of coffee in the morning, right? And where can we maybe make some changes that might be having an impact on our mental health without us even noticing? Now, pet and animal therapy, I'm sure we're all familiar with this one. Maybe some folks even have their own animals in their offices or in their work. But of course, we know the power of our pets, and whether that is helping support somebody in, you know, maybe taking on the responsibility of becoming a pet owner. Maybe that means having their pets, you know, become trained in terms of responding therapeutically, or even if that just means finding ways to get outside and engage with more animals, right? Getting into nature and seeing the squirrels and seeing the rabbits and all that, or spending more time with folks who have animals, or volunteering, right? I actually have a client right now who's currently volunteering with the Oregon Humane Society and gets to go and walk the dogs and absolutely loves walking the dogs, right? And finds immense amount of joy with it. Reflexology is a type of therapy that uses gentle pressure on specific points along your feet, possibly your hands and ears as well, is my understanding. Generally, it's primarily your feet, but I believe you can also do hands and ears too. And this is essentially, you know, again, kind of almost similar to acupuncture, not the same. They're definitely not the same, but similar in the sense that it's creating pressure on very specific points in the body that are meant to help create release. Right, there is a lot of, absolutely a lot of options there in terms of creating some relief using the body as a mechanism for this. Oh, I got some questions. Do you consider EFT tapping a holistic treatment? We probably wouldn't consider EFT a holistic treatment, but I definitely think you could argue that tapping would be. I definitely think you could argue that tapping is a holistic treatment for sure, especially because it's right, it's engaging in that very similar realm as the reflexology and the acupuncture, right, in terms of sort of creating connections with specific points in the body. So yes, I definitely think that tapping is a holistic. I don't think probably EFT, emotionally focused therapy, I don't think that would fall under holistic, but I could definitely be wrong. I probably say that falls in the more clinical realm, but audio keeps going out. I'm so sorry if the tech is not working. I definitely would say check out that GoToWebinar Tech Help, see it if there's any issues there that might help address the audio. I will ask, is anybody else having audio issues? Are we struggling to hear me at all? Because if it's me, I would like to know that for sure. I will try to make sure that is okay. It looks like other folks are feeling okay. All right, all right. I'm so sorry. It might be on your end. I maybe would say check out that GoToWebinar and try to come back in, see if that helps. But it looks like we're doing okay tech-wise. Okay, awesome. Well, kind of continuing on sound therapy, I mentioned this one before. This can be the things like I mentioned, you know, use of like gongs, bells. You know, I'm forgetting what they're called, but I'm forgetting what they're called, but they're like the bowls that you sort of spin. I'm blanking here. I should absolutely know what that's called, but those are all variations of sound therapy. There's even apps, if for folks are maybe familiar. For example, the app I always recommend is called Sound Bath. Thank you, Sound Bath. I totally blanked on that. Yes, Sound Bath. Absolutely. But there is an app I recommend a lot to clients called Insight Timer. Insight Timer. It's a really interesting app. It is a meditation app, so there are meditation options on that. Sound Bath, B-A-T-H, Sound Bath. I know it sounds strange, right? But it's essentially this idea of the immersion of the sound, right? Where you kind of are immersed in that specific sound, because these particular instruments, now obviously this could be expanded out. You could really argue sound therapy just encompasses any use of music or sound at all. But the ones I'm very specifically thinking of involve very particular instruments that create a very specific frequency, a very specific pitch that can be very soothing and pleasing to the brain. I kind of like to describe it as it's almost like it's scratching an itch in the brain that we can't really access otherwise. But for whatever reason, the sound can access it. So very cool, right? The app that I mentioned is called Insight Timer. Insight, like I-N-S-I-G-H-T, Timer, T-I-M-E-R. So it is a meditation app, like I mentioned, so there are meditations on it. But the reason why I like this app as opposed to some of the other ones like Calm, which I'm sure we're familiar, is that Insight Timer also offers options for sound therapy. They have recordings of different types of instruments and frequencies that you can use. You can put them into your meditations if you're trying to start a meditation practice. You can add in particular sounds at certain spots over the course of your meditation. Like if you're doing a 5-minute meditation, you could put something at the 2-minute mark, something at the 4-minute mark, right? And it's going to play that sound while you're meditating. It's a really great app, I would actually argue. It covers a lot of different resources under that umbrella of mindfulness and meditation, and sound is one of them. So if that's not something you're familiar with, very fair, but if you have clients who are curious, or you have clients who are very auditorily leaning or engaged, right? They use sound a lot. I definitely think that's a great recommendation to make for folks to kind of explore. Now, spiritual or energy healing, this can look like a lot of different things as well. I think we kind of frequently think of that as something maybe like Reiki or sort of this concept of chakras and trying to address different, which if we think about, if we're familiar with chakras, right, we have very specific chakras in certain locations of our body, and they do certain things when a chakra is clogged or it's not functioning well. So it's kind of trying to address those specific areas. And lastly is yoga, I have up there, which I think is probably the go-to one that people think of when they think holistic health or holistic options. Of course, though, being that yoga really addresses that mind-body connection, and it also engages with breath work, right? Which is, as we all know, something that is very effective and likely something we're using regularly. Now, I know I have all these up here, and as I mentioned, I am going to go into some of them a little bit more in depth, but before I moved on into those, because I'm going to talk next about some herbal supplements, some herbal medicine options. Did we have any questions about any of these in particular, or anything you would want to add? Anything you'd want to add to the list? Because like I said, non-exhaustive. There's definitely more stuff we could probably throw up here. Like tapping. I should have put tapping up there because I'm going to call that's holistic for sure. So I probably should have put that one up there, honestly. But any questions, thoughts, anything you'd like to add in there? Heard of a dark room? Interesting. Is that kind of like a sensory deprivation kind of idea? So I certainly have heard of those, and I know those can be very helpful too. I'm not sure though, if that's not what it is though, maybe I'm wrong. I'm not sure what that is. A dark room. I'm also now picturing like the old school photographs, right, where people had to be in the dark rooms to like make the photographs show up. Yeah, sounds like people will go into a dark room for a couple of days. Celebrities are now doing this. Oh boy, well, if the celebrities are doing it, it's probably gonna come to us soon, right? Yeah, so going into a dark room, interesting, floating in water in a dark room. Yeah, those types of sensory deprivation ones definitely have been shown to be very helpful. I know, for example, here in Portland, we have full facilities that just do like the sensory deprivation tanks. I'm also, as I'm saying this, I'm gonna add in there on this list cryotherapy, because I've actually done cryotherapy, and I know that is a recommendation. So cryotherapy is going to be when you get yourself in that freezing cold temperature, right? Like I'm talking -40, -50. And you're in there usually for about 2 to 3 minutes, depending on what your stamina and tolerance is for the cold. But it's been shown to have a lot of medical positivities, including like reductions in inflammation and stuff like that, but also substantial health issue, positive mental health impacts, which I'm sure probably wouldn't surprise folks when we think about that DBT skill, right, of that sharp change in temperature to the cold as being very regulating. Cryotherapy is like a larger version of that. But that is really reminding of me that based on those sensory deprivation tanks, right, and that floating in the dark, in a dark room in the water, right. Getting outdoors, not just for exercise, but to get a hit of serotonin through the retina. No glasses or sunglasses. I can't remember how many days a week, but I think it's 15 minutes, 3 to 4 times a week. I've also heard this, right? Getting that direct to the eye instead of it going through sunglasses or a window or something like that, right? Getting that direct sunlight access. I'll say especially for the folks who are in locations geographically that are more inclined for less sunlight, right? If we got folks who are in the Pacific Northwest, up in the Northeast, right, in Alaska, right, we are already kind of at a deficit when it comes to our sunlight. So that certainly is always a great recommendation and skill, for sure. Any other thoughts? Okay, well, I'll keep going for the sake of time, but I wanted to talk now a little bit more in depth on some of these that I mentioned, and I did say I was going to go in more depth on a couple of those. So starting off was that herbal medicine, herbal supplements. Now, I want to acknowledge right now that the majority of us, based on what I know from our degrees and the folks on this call, we are not legally able to prescribe medication, of course, and not necessarily be part of that medication management either. Now, that being said, there's obviously a lot of other options there outside of prescription medication that can potentially have a positive impact on somebody's mental health that don't necessarily require a prescription. For example, I don't have it up there, but the most common recommendation I make, because again, I'm in Portland, is I'm constantly telling folks to get a vitamin D supplement, right? Especially in the dead of winter, right? I'm like, listen, we don't got a lot of the vitamin D right now. Let's try to supplement it elsewhere. So vitamin D being a recommendation I personally make quite frequently. Now, that being said, there are some other things that I do like to touch on here. Some of these probably are familiar to you, and they tie in a little bit with that aromatherapy. So for example, the chamomile and lavender. Now, chamomile is going to be ingested more so, right? We're going to drink that. Usually in tea is probably where we're most familiar with chamomile. But the research suggests that regular use of chamomile is helpful for reducing symptoms of moderate to severe generalized anxiety. It's very interesting of a concept, right? I think we do need a lot more research into terms of what is sort of going on chemically that is making these helps, or is making these changes. But chamomile has been shown to actually reduce specifically generalized anxiety symptoms. So, kind of maybe having that as part of a routine. And again, if we're thinking holistically, we can also be thinking about, all right, well, how's your sleep? Can we set up a sleep routine, a sleep schedule in the evening that helps best support your sleep, that helps support your reduction in anxiety so that you can access better sleep? And for some folks, maybe that means adding in some sort of chamomile in the evening to start that process or to indicate to the body, okay, it's time for rest. It's time to move into sleep space. Let's sort of lower our levels down. Lavender is super common. I think most folks probably know about lavender. The research has pointed to an improvement in anxiety symptoms from either consuming or smelling lavender. So lavender could go either way, right? That could be aromatherapy where we're just inhaling through our sense of smell, but we can also consume lavender too. I mean, that is not harmful to you. And I would also argue it's becoming more popular. I feel like everywhere I go now, there's, lavender lattes or lavender cookies or, whatever it might be. And interestingly enough, I will point this one out. The research says that lavender in particular can be very helpful for folks before surgery, before going into a major surgery, and before and after chemotherapy. So if you have, clients who are getting ready to go into a big procedure, they're about to have a big surgery, or you have a client who is currently battling cancer and is utilizing chemotherapy, this may be, small. Obviously, it's not going to change tons of things, but these can be potentially small suggestions to help make those processes a little easier, a little bit more manageable. Especially thinking about folks who maybe have medical anxiety, and something like a surgery is going to be very, very triggering for that anxious experience. Now, next up I have is vitamin B, specifically B12. So this is newer research. I do want to acknowledge that. I think there's probably some room here for this to be a little bit more researched a little bit more in depth, but newer research is suggesting that it is not uncommon for people with anxiety to have low levels of B12. This is where they need more research. They are making the sort of assumption that there is a correlation in that causation, or there is a causation in that correlation. So it's believed that by adding more B12 in, we can help reduce or prevent anxiety symptoms. So this one I would maybe say to take with a bit of a grain of salt, because like I said, this is newer research. This was probably the newest one that I saw. But that being said, they are seeing a connection with folks who have higher levels of anxiety having lower levels of B12. And so definitely an area of interest, definitely something to consider. And as some folks were mentioning in the chat box, part of maybe your holistic approach is recommending to folks that they go see their primary care. Right, go check out your primary care. Let's get a blood test, right? Let's get some stuff, let's get some tests to see if there's anything going on here that's having an impact. You know, I'll even say for myself that I went to the doctor and I thought I was doing good. I thought I was fine. Turns out my vitamin D was in the floor, right? And I needed to take a vitamin D supplement. And of course, as soon as I started taking it, I noticed a difference, right? But I had no idea until I took that test, right? Until they did the blood test. How much B12 a day? I don't want to necessarily recommend that because it's probably going to be different per person, but B12 is something that you can buy right in the pharmacy. You don't need a prescription for it. It's like most other vitamins. So what I would say is I would follow the recommendation on the bottle. So whatever the bottle says to you, if it's like, this many a day, I'd probably go with that. But maybe definitely recommending to clients that they speak to their physician further if they have more questions or curiosity about what would be best for them. But definitely, I think highlights that need for, as some folks said, to go and get testing done, right? Is something going on with the thyroid? Is something going on with my hormones, right? Is something going on with my vitamin levels, my iron levels, right? We know now that these things directly impact our mental health. They are not separate, right? And this is one way we can start addressing that, right? Now, I can never feel like I say this word correctly, so if I don't say it correctly, please feel free to laugh at me, but L-theanine, maybe that's right. Maybe not, I'm not totally sure, but I'm gonna hope that that's correct. There's some more research. That is correct. Cool, nice, thank you, appreciate it. I've only ever read it. I've never said it out loud. I've never heard anybody say it, so I'm always like, is that right? Okay, but anyway, there has been a study. There's only been one study here. So again, we need more research, but there has been a study that found that 1 month's worth of an L-theanine supplementation is a natural anxiety remedy for people who are not already inclined for anxiety. So I do want to specify that, right? What they really noted here is that this can be helpful for folks who are experiencing more low-level baseline anxiety, right? So I'm not talking that like more severe end of the spectrum, right? What we would consider to be much more disordered anxiety. I don't necessarily think it's going to be helpful for folks in this realm. At least that's what the research is kind of arguing. It is saying it can be a nice natural remedy for folks who are maybe experiencing more low-level anxiety, right? Maybe more or less distressing, less dysfunctional anxiety. The term they use is healthy people, which I don't love that. I don't love that description at all, but that's what the research article used. It said it can be a natural remedy for healthy people. Don't love that, but I'm pretty sure what they're trying to say when they refer to that. All right, next up is magnesium. I don't know if folks have heard this one before. I've been hearing about this more. I've been seeing this more, and I've actually even had a client ask me about it. But there has been some research around magnesium and its help. So a couple of different research settings have found that magnesium supplementation can potentially reduce mild anxiety symptoms, generalized anxiety symptoms, and anxiety symptoms that are related to PMS. So that are directly correlated with that menstruation cycle. So maybe folks who are experiencing sort of that PMDD, but are experiencing much more heightened levels of mental health distress when they are menstruating, right? And magnesium also helps regulate sleep cycles. Absolutely. So magnesium, I would really argue that one is picking up more speed. I definitely think we've noticed that in the past couple of years that magnesium is becoming more of a go-to, right? Maybe a little bit more of something that folks are wanting to try. And then lastly is lemon balm. And this one is kind of similar to the lavender one. That can be something that we smell or we consume, you know, or we digest. But again, just as research has argued that this is a natural way to reduce anxiety symptoms. The last one, and I'm recognizing that I might have accidentally deleted out of my slide, which is completely my fault, is actually omega-3s. So maybe folks have heard of this too, but there's research that reveals that omega-3 supplementation can help significantly reduce, but also prevent anxiety symptoms. This is especially true for people who have been diagnosed with very specific anxiety disorders. So generally that's going to be things like, I believe it's panic disorder, and then phobias, and, oh, what is it? Social anxiety. I believe it was. So it's been shown to help reduce and prevent, which I think is really, really interesting. And again, I know I don't have this on the slide. I'm referring to omega-3. I'm talking about omega-3 right now. So that is my fault because I don't have it on the slide. But I'm talking about omega-3. And this is the only one that has been shown to help prevent anxiety symptoms, right? All the rest of them are going to be more reactive. This one is potentially proactive. Before I move on to the next one, I did want to ask, was there any other herbal supplements that, or anything else that would sort of fall under this umbrella that folks would want to throw out there or offer? It's something maybe you've recommended or you've used or seen, or you know, have a client doing that's really helping them. If not, totally fair. I got it all. I covered all of them. No, I'm just kidding. Totally joking. There definitely can be more options out there. I do think that this is worth considering. There are natural ways that we can potentially help. And what's also helpful here is that for all of these, we don't need a prescription for them, right? We don't necessarily need to go to the doctor and, you know, go through that whole rigmarole of going to the doctor and getting the stuff and getting the prescription and right? We can just go to the pharmacy and those are available. So there's also an accessibility piece to this that I think can be really helpful for folks. So I got a couple of suggestions. Folate for synthetic B12 sensitivity. Great point to make for folks who have that B12 sensitivity. And ashwagandha, I should have put that in there. Oh, you're totally right. That's such a great one. Ashwagandha, that's another one that has, I think, again, in the past few years, really picked up steam. If I'm not mistaken, ashwagandha is a mushroom, if I'm not wrong. I can be wrong. Totally call me out if I'm wrong. But I believe it is a mushroom that is, again, supposed to be very naturally help. You're totally fair. How do I spell that? Ashwagandha. It's going to be ASHWAGANDA. A lot of A's. Just going to really quick give a shout out to Michelle for spelling that on the questions box so I could spell that properly. Can't remember, but I see it in tea and pill form. Beef liver for people who do not metabolize iron pills. Great suggestions, folks, because I love this too, because obviously some of us are not going to be able to take some of these. They're not going to work with our body right. So we want to think about some alternatives. And I also like that point out too of that we can very, very, very much experience mental health distress and symptoms if we are missing, you know, certain nutrients, certain vitamins, having low levels of iron, right? Stuff like that. So it's definitely always something worth talking about, worth thinking about, and worth addressing. And then we've got N-acetylcysteine, NAC, for compulsive behaviors. Interesting. I didn't know that one either. I'm also apologizing if I did not say that correctly. You're probably gathering I don't always do that. But acetylcysteine, so ACETYL space CYSTEINE. So for compulsive behaviors. So that's great to know. Great to keep in mind. All right, well, kind of continue on for the sake of time. I did want to talk a minute about breathwork and breathwork practices. Now, here's the thing. I don't know if other folks have had this experience. Oh my gosh. So I usually suggest to clients get a mineral panel test instead of just a blood test. Excellent, right? Getting a mineral test, and maybe also a blood test too, if they haven't done that in a while, right? Always good to check in on those. But a mineral test, definitely. Seeing what we're missing, seeing what we're needing more of. It's always a great place to start. Now, the breathwork practice piece, I did want to talk about it for a minute because one, and I don't know if other folks have had this experience. If you had, awesome, maybe let me know so I don't feel quite as much of a weirdo, but I very frequently, when I talk about breath work, I sometimes get folks who push back a little bit on breath work and go, I mean, breathing's not going to help. That's not going to do anything. Like, yes, I know I need to breathe. We all have to breathe. I'm going to breathe. It's fine, right? But that doesn't help me. I'm not going to use that for regulating or as a coping mechanism, right? I've had some folks, kind of describe it as being like frou-frou-y or like very therapist-y, which is fair. I mean, I can acknowledge that maybe it is a bit frou-frou-y. Some folks have had that, yeah, breathing doesn't work or meditation isn't helpful, right? Totally, I've had that happen many, many times. And I completely understand, where clients are coming from. I would be a liar if I didn't say there wasn't like a small part of my brain that also kind of sometimes thinks that, even though I know it's not necessarily true, and there's a lot of research to show that. But I do really like to kind of reiterate to clients the sort of biomedical reasoning behind breath work and what is helpful here. So, for starters, breath is the only thing that we do that is both conscious and unconscious, meaning that we will unconsciously breathe without thinking about it, but we can also consciously make an effort to breathe too. It is one of the only things that we do that is both internal and external, right? It's going on in here, but it's also coming out here, right? And ultimately, it is our life force, right? If we're not breathing, we're not alive. Breath is necessary, of course. Now, on that medical perspective, good solid breathing and having good deep breaths and exhales improves oxygen capacity in the blood. This directly influences the amount of energy that is released into our cells, right? And it improves the mind-body connection. Those are both involved in that process, which builds our stamina. Now, breathing, one of the things that I like to really highlight to my clients when I talk about it is that we are trying to help sort of regulate the body physiologically in order to reduce our stress, right? Because it's not necessarily going to take away what's going on up in the brain, right? Breathing is not going to take away, the fact that I can't stop thinking about that, meeting I had and how bad it went, right? Or the fact that I have this deadline coming up. It's not necessarily going to take away the more cognitive side of anxiety. But what breathing does do is it brings your body back down to a baseline. Right? It helps re-regulate the internal system so that we aren't experiencing quite as much physical distress, right? Now, the things I like to emphasize is that we really want to make sure we prioritize our exhale. Your exhale, very specifically, is where your blood pressure lowers. So if anybody has, like, I have an Apple Watch, if you have any variation of that and you have one of those things that tracks your heart rate, you can actually go in and watch this happen. When you inhale, your heart rate actually increases. Not usually a ton, not like a scary amount of increase, but it usually goes up a little bit, your heart rate. Now, when you're exhaling, that is where your blood pressure drops. That's where your blood pressure lowers. We see our heart rate come down in the exhale. So I really like to emphasize, extending and drawing out those exhales in an effort to lower that blood pressure, lower that heart rate, which will hopefully also result in lowering the breathing rate. And then we're hopefully regulating now all of the different systems, right? Now, I have a ton of different breathing examples up here because, as I'm sure folks know, there are like tons of different breathing exercises. There's lots of options and very wide ranging depending on who you're working with. Oh, I got a comment. So great psychoeducation resource is Anxiety and Phobia Workbook. I'm going to guess that meant phobia, not phobia. So Anxiety and Phobia Workbook, Born and Born, available in the library and on Amazon in paperback. Yeah, it is phobia. Okay. Just a minute, it's like, it could be phobia, I'm not sure. So Anxiety and Phobia Workbook by Born and Born, like Jason Bourne, like the Bourne Ultimatum, right? That kind of Bourne. And then improper breathing can lead to elevated carbon dioxide levels in the blood, which is known to lead to confusion, altered mentation. Yeah, absolutely, right? So when we don't breathe well, there's some really direct consequences on this. Now, one of the other things I like to teach folks is I actually teach an 8-hour class here around mental health for folks who are not clinicians. It's meant for the layman, right? And one of the things that I do is I actually have all of the participants figure out and determine what their resting breathing rate is. Why I do this is because there is actually now a pretty substantial amount of research that says folks who have a naturally higher resting breathing rate are more inclined for anxiety, and they are more likely to be diagnosed with an anxiety disorder. So what is a high resting breathing rate? So the average adult, so this is for adults. I don't know the specific ones for kids, if I'm going to be honest. I generally work more with adults. So for adults, the average resting breathing rate is usually going to fall somewhere between 12 to 16 breaths a minute. Okay, so you're taking about 12 to 16 breaths every minute. If you're in like super good shape and you're running, Ironmans and marathons, and you have incredibly good aerobic strength, your resting breathing rate will likely be lower, right? Maybe like a 7 or an 8. Those are for folks who are in really good shape. So what does it look like if it's higher resting breathing rate? So the research shows that if you have a resting breathing rate that is above 15, so 15 or higher, you are more inclined for anxiety. The argument, and it's probably, I would argue it's probably fairly obvious, right? The argument is that if your breathing is naturally escalated, if you're already just baseline higher in your escalation, it is much easier for you to amp up, right? It is much easier for you to move right into that anxious space because we're already slightly elevated compared to folks who have that lower resting breathing rate. And this is important to note because we can work on this. Your resting breathing rate is not stuck. That is actually something you can change. And how do we change it? Breathwork practice. Breathwork practice is how you can change your breathing, but you can actually work to lower that natural resting breathing rate. And breathwork, of course, is going to be the way we do it. Now, I'm not going to go through every single one of these because there's honestly a lot of them, and I'm running out of time. But I will say that in my experience, it's best to work with the client to figure out what feels best. Have a couple that you like, that you go to, right? For me, I love alternative nostril breathing. Anybody who does yoga maybe is familiar with this one. It's where you're breathing out of alternative nostrils. That's the one I'm most likely to teach my clients because it also gives them something physical to do, right? They have to touch on their nose. In my experience working with clients who have anxiety, they don't take a full breath. Yes. Helping them recognize this seems to be helpful, 100%, right? And even literally sitting with folks. And this is part of that biofeedback we were talking about too, right? That's biofeedback, is that taking those deep breaths. Okay, I'm running out of time here because I talk a lot, so I'm so sorry about that. But lifestyle changes, I think a lot of folks already mentioned quite a few of these, and I think most people are probably familiar with them. I won't spend too much time on this, but reduction or elimination of alcohol use. We know alcohol is a depressant. It really tends to amp up folks' anxiety. It's not to say we have to completely eliminate it, right? We're all, people are allowed to do what they want, but maybe also helping clients recognizing the connection between their alcohol use or their substance use and the way they feel. Same thing with quitting smoking. Nicotine and tobacco, they are stimulants. They amp us up. So recognizing that as well, which I also think is interesting. And I say this as someone who's a former smoker. I quit smoking a couple of years ago. But what's interesting is that for many folks, smoking is a coping skill. Something stressful happens, they go out and have a smoke. But what we don't know is that's amping us up because it's a stimulant, right? It's pumping that blood pressure up. It's pumping up that heart rate, but it's used as a coping skill. But why it's used as a coping skill is people are taking big, deep breaths. When you're inhaling smoke from a cigarette, you're taking a big, deep breath. And so there is that connection again to breath work. So how do we do that maybe without the cigarette? Moderated caffeine consumption. I already mentioned this one. I have absolutely had clients, when I ask them about this, proceed to explain to me that they have more caffeine in a day than what exists in the Starbucks, right? And I'm like, all right, well, maybe we want to talk about this. And I also say this personally, my sister, for example, she ended up on high blood pressure medication because she was drinking so much coffee. And when she stopped drinking as much coffee, she instantly got off the high blood pressure medication. So there we go. There are definitely correlations there. Getting 7 hours of sleep at night, of course, prioritizing nutrient-dense and balanced nutrition, scheduling in relaxation time. I tell my clients, you should take time to just exist. You don't need to be doing anything. You just want to exist. That actually is good for us to just take that space. And sometimes that means making it an actual part of our schedule and working obviously with our clients and helping them be able to prioritize the things that help them feel good. So mind-body connection, talked about quite a few of these, right? That exercise that combines body movement, mental focus, and controlled breathing to improve strength, balance, flexibility, overall health. This is different, right, than just from other forms of exercise in that there is some very intentional a connection between the body movement, the brain, and the breathing. Yoga is obviously the one that most folks' brains go to when they think of this, because there is a very specific breathwork flow to yoga. It is obviously quite physical. If you've never done yoga, do yoga. You'll learn it's very physical. It's harder than you think it is. And that also pulls in the brain too. But there's several options: Tai Chi, Qigong. Those are all, of course, some very specific types of body movements, self-defense, things like that. But gardening, swimming, right? Heck, you know, there's lots of options there. Swimming is a great one because swimming forces you to do a breathwork practice whether or not you want to, right? Because you have got to regulate your breathing if you're swimming, because you're going in and out of the water. Now, I would ask if there are others, but I do appreciate that I'm out of time because I talk way too much and I do need to figure out how to not talk. This is my last slide. So if folks do need to leave, of course, please feel free to pop off. I will have this as a recording out if you wanted to watch the last bit. But if anybody has the time and wants to hang out with me on this last slide, love to keep you around. Last one I wanted to talk about was meditation, especially because I did talk a fair amount about mindfulness and breath work. There are about 28 primary types of meditation. I have up here the 9 most popular, okay? Meditation is just like mindfulness. It is a concept that has existed for thousands of years. It dates back to, I think it's around like 1200 BC in India. It's a fundamental component of several different cultural and ethnic practices. And the meditation will look different depending on which cultural aspect you are coming from. So again, there are about 28 types of meditation. I have up here the 9 most popular. Some of these you probably have heard of or maybe are familiar with. Most of them do not require a practitioner. The exception to that is going to be that transcendental meditation really does require a practitioner. That one is not something that they usually have folks doing on their own. There's very specific practitioners who sort of teach the transcendental meditation. So that one usually will require a practitioner, but the rest of these are not really going to need that. Folks will be able to do this sort of on their own. Mindfulness ones being, you know, meditation that pays attention to your thoughts. That's where your focus is on. It's on your thoughts and reducing any judgment that comes through with that. Right? Spiritual meditation is meditation that focuses on that higher power. Right? That's where we're focusing. Focused meditation involves using any of the 5 senses. So there's a lot of options there, but directing your focus to one of those 5 senses. Movement meditation is kind of like what we talked about before, but it's an active form of meditation, and it's usually involving movement that connects you deep into your body. Movement meditation is generally also very good for people who find peace in action and want to develop more body awareness, right? So maybe some of those folks, maybe we have that, you know, the clients who struggle to slow down, right? They struggle to pause, to take a break, right? It's kind of onto that next. They like that action. It feels good. So movement meditation can be a great way to engage with that. Mantra meditation uses a mantra, some type of repetitive sound to clear the mind, and that can be, you know, a literal mantra, but I would also argue you could use sound at that point too, right? That could be, you know, one of the bowls, the bells, the gongs, stuff like that. And loving kindness meditation is meditation that focuses on developing feelings of compassion and kindness towards other people and ourselves. And then eventually that takes you to the finding kindness and compassion for people you don't like. That one is probably the hardest level, right? But that's kind of the end goal. Visualization meditation, I would really call that visual imagery, right? It's just having folks visualize places, feelings of relaxation, peace, immersing themselves in those spaces. And then progressive relaxation meditation. I really like that one too, especially when it uses the muscles. That's very intentionally creating spaces of distress in the body, right? Where you're tightening the muscle and then feeling that release and then meditating on that release, right? That feeling that you get when you are squeezing a muscle and then you let that muscle relax, kind of feeling that tension sort of leave your body. Now, of course, there's lots and lots out there. Definitely would encourage doing a little research in terms of what feels good for you. And like I said, I also usually recommend having one that you fall back on to help demonstrate to clients. So for me, it's always progressive muscle relaxation meditation because it's something that's very tangible. And for folks who don't like meditation or are not very comfortable in it or don't feel like they're very good at it, right? Like I know some folks said, this can be helpful because it gives you something specific to like focus on and do with your body instead of just sitting and trying to get into these head spaces that we're talking about. But that being said, I do very much recognize that I am out of time and I do want to be respectful to everybody. So thank you all so much for being here. As we're wrapping up, just quick little summary here, we want to think about all components of a client's experience. If it's helpful, maybe even keeping those 8 pillars of holistic health readily and available. And maybe even sometimes I occasionally will even use that through an intake where I'll like kind of check in on each of these areas to see what it looks like. Encouraging a wide range of treatment options other than just our defaults. Obviously, they are our defaults for a reason. We don't want to get rid of those, but definitely keeping in mind some other options that can be helpful. Exploring alternative areas of treatment you're unfamiliar with. This was a pretty broad overview, this training was, right? I didn't go into super in depth on anything in particular. And so if there was something that you are resonating with, or you are thinking, I'd like to learn more, I definitely, hey, let's learn more about it. You know, we're all constantly evolving. I know this as clinicians, we're always constantly growing, we're constantly learning, there's always new stuff. And this movement we're seeing for holistic health is part of that. So continuing to, you know, educate yourself, especially in the things that pique your interest and resonate with you. And continue to utilize the supports and treatments that work best for you and your clients. I'm never here to tell you what to do. I am never here to tell you how you should do your job, but certainly recognizing what does work for you, what doesn't work for you, and if it is helpful to have kind of some of those defaults you can fall back on. So that being said, thank you all so much for being here. It looks like I caught, when does the credit info get sent out? I believe it should be sent out today. If I'm not mistaken, you are, once the webinar ends, you'll receive like a survey and stuff, and then you'll receive an email out afterwards that should have that credit in there. So of course, if you have any issues though with this, please feel free to give Canopy a call. If there's any questions or you for some reason don't receive the credit or whatever, please let us know. Of course, give us a call, let us know, and hopefully we'll get the slides sent out as well too. So I mentioned for those folks who were not able to access it in the handouts, make sure that gets sent as well. But otherwise, thank you all so much for being here. I really hope you have a great hump day. If you're in the Portland area and you're as hot as all heck like I am, I hope you stay cool and have a lovely rest of your week. And of course, please let Canopy know if there is anything that we can do to help you all and support you all. So thank you so much. Have a great rest of your week. Thank you. Take care, folks. Don't work too hard. Right? All right, take care, everybody.